so I'll open up for questions. Question over here.
Bearing in mind that the majority of people with MND have sporadic MND, is there going to be testing of people with sporadic MND to see whether they have the same genes in sporadic MND?
Yeah, generally no. There's generally little point in testing apparently sporadic cases for familial genes. There seems to be perhaps one exception, this new gene C9orf72. You'll see I put up a slide that said there's 3% of sporadic cases. And in other patient groups worldwide, that's as high as 7 or 8%. So it looks like there is, for that gene at least, perhaps a good reason for testing those patients. What that means though, if it comes back positive, does it mean is this really an instance of familial disease that just hasn't been recognised, and has family history not been taken well enough by the neurologist, or even not known about the family member themselves? They really need to go back and look at their family history, because in many instances MND will either be misdiagnosed or the ancestor will have died before the disease ever would have manifested.
Ian, is it possible yet to test at-risk family members for the C9orf72 gene?
Okay, so the question is, can we test at-risk family members for this new C9orf72? Yes. We just insist that it's after genetic counselling.
Thank you.
Thanks very much for a great talk, Ian. I was just curious, it may be too early to say, but I wondered whether, like other nucleotide repeat diseases, is there any relationship between the size of the expansion and the risk or the age of onset?
Good question. So is there a correlation between the size of the expansion in this new C9orf repeat and the age of onset or other features of the disease? It's very technically difficult repeat to size. I showed you a sawtooth pattern that will allow us to diagnose it. That sawtooth it can only go up to a certain size. It will extend up and beyond the normal range. It will not allow us to determine the full length of the repeat, and there are methods being devised. We're one of the groups that are trying to devise the methods to actually determine the full size of the repeat. But it's very ambiguous, the size. So, bottom line at this stage, we don't know. There have also been studies to see whether the size of the normal repeat, because we can determine that size, whether that is related to age of onset or in these families, or even any other in cases. And it's quite unequivocal that there is no relation between the normal repeat length and any features of the disease, and that's just very recent information.
This is a member's question. I was told I have sporadic MND. However, last year my father's elderly brother died of MND. Is this a coincidence, or does it change my classification?
Can we get that relationship again?
My father's eldest brother died of MND.
Right. So it's an uncle. We have an uncle and nephew. Have you heard of it? So we have an uncle. like the nephew was diagnosed with MND, the uncle was diagnosed with MND sometime later. Niece. Niece.
No. Niece.
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 Yes. That is one instance where I strongly suspect they're looking at unrecognised familial MND. Yes.
Just trying to grasp some of those figures that you've given us. Am I correct in saying that it was 10% familial and 90% sporadic? Is that right?
Yeah, so,
Yeah.
yes, the
What was,
figures.
taking that, knowing that then, the test for the CR orth, is that of equal amounts of people, familial and sporadic?
Right. So this is the proportion of C9 or mutations amongst familial and sporadic cases. We tested I think almost 200 familial cases and around about 800 sporadic cases. So they're all the cases that we have access to. And when I say familial cases, that's 200 families. So we just test one individual from each family. So the incidence is so 40%, so it accounts for 40% of the families. So when you see it in one individual in one family, then by inference we know that every affected individual in the past, in the current or in the future will also carry that expansion. The 3% in the sporadic, we have no 3% in those 800. We have no information on whether those 3% represent familial disease or not. I strongly suspect that some of them will be unrecognised familial cases rather than sporadic disease. But looking at the incidence worldwide, it may be up to 8% in some sporadic cases worldwide. That would seem to be too high to just be explained by unrecognised familial disease. So it appears that there is at least a small proportion of sporadic cases that can be caused by mutations in this gene as well. And I do not, at this stage, understand how that works. This is the exceptions to the rule are very often the most exciting things in science. It usually leads to some of the biggest breakthroughs. And so I think something may come from that.
Would it not be possible to answer this with triplet studies, getting DNA from both of the parents if they're around?
Yeah, absolutely. This is one of the excellent genetic approaches to studying this is to do trios, what we call trios, where we can have, if we're lucky enough to have access to DNA from the parents of a sporadic case. So very often though, the parents are no longer living, so we do not have access to that. But if a sporadic case exists and the parents, both parents are still alive, then getting DNA from that trio is a very powerful tool for genetics. So if anybody knows of it, please let us know.
Just on that, is there any opportunity for people with sporadic MND to donate their DNA at this point in time?
Yes. Well, this is there is a sporadic MND DNA bank. It was established by Professor Roger Pamphlet about 5 years ago. Our laboratory is largely taking that over, and so we will. Unfortunately, the infrastructure has and the collecting has not been quite as regular as it has been in the last few years. But we are about to start gearing that up again through funding from the MND Research Institute of Australia to start that collecting again. So there should be information coming through the MND Association. Each state when collections will take place for sporadic disease.
So we normally have a collection here at Ask the Experts, so we haven't this year, but maybe in the future. Any other questions? There's one over here.
Just got a question related to one of your previous slides. You know how you said there was a slide about someone who's colourblind, and you said the number was 74. It got me worried for a second. I thought I saw 21, and you said someone who might be colourblind might have seen 21. Do you mind going? Is there any chance I can get back to that? Do you know what I was just?
Well, now I'm not a clinician, but I'm happy to give you the test again. And if you're not seeing the number 74, perhaps you can take that up with your doctor. The incidence of colour blindness, it's not uncommon in the general population.
Probably see both.
Right.
I want to know how many people can roll their tongue. and another question up here, Caroline? Or are you getting one there?
Just before you go, can I just ask a question here on my other side here? With all your testing, have you found that there's been outside causes for the duration? That you found possibly in some parts of Australia the duration is shorter, and if it's not environment, is there stress or some other thing where it brings a different duration to it?
No, that's a good question. Are there any features that we've seen that can explain the variable age of onset or perhaps the variable duration of the disease? No. I can say that we've looked at a lot of different factors in families. And families are ideal because generally, certainly for the children in any one generation are often exposed to the same same environments. But even within that generation, we can see huge ranges in age of onset. There are some sideline families that we know in one generation can range from 27 to 86. So the environmental features, the environmental variables, no, we have no idea. But there are likely to be some genetic factors as well, not just environmental factors. And those genetic factors, and this is why they call them complex genetic diseases, because it's very difficult to identify those genetic factors that are conferring a risk to onset or are increased risk to developing the disease or developing faster. We know they're out there, we haven't found them, we don't know what they are. Sorry, I can't give you a better answer.
So that I understand what you said about what's the camper DNA, I got my DNA to Russia some time back. Would you still have that?
That's right, yes. So this is what is the state of the MND DNA bank. It exists, it still exists, and researchers worldwide can access it. We have accessed every sample in that, and we are working with every sample in that bank.
I'm just wondering about the trio. Does it have to be the three, like the two parents? And
Yes, you really need both parents. Unfortunately, just one is not a great help.
Do you know if there's pockets of areas that are more with MND than others?
The
Or in
question,
Australia to what there is a disease? Or
the question is, are there
more people, say, living in Sydney with MND than say
are there
elsewhere?
pockets of MND spread throughout Australia that can be recognised?
Yeah.
Not to my knowledge, and Professor Williams alluded to this, where access to a neurologist can be something that increases the likelihood of MND being seen in that area. I'm not aware of anything any pockets in Australia or anything that can create a pocket. Sorry, I can't answer anymore. And having said that, there is, worldwide, there are a couple of pockets recognised. There's one in Guam, the island of Guam, and there is one in the Key Peninsula in Japan. But what has caused that, these are variants of MND, these are a little bit different, they have Parkinsonism as well. What has caused that? There's some argument that there is some neurotoxins in the local vegetation, but there's been studies that have actually contradicted that. So it's a very complex and contradictory field, unfortunately.
Okay, I think we've run out of time, and I'd really like to thank Dr Ian Blair for his presentation, and also to acknowledge that we have some good gold diggers in Australia, and we really do, stand out in the world with our researchers and the work that they're doing. So thank you, and we have a very small gift of our appreciation.